Carolina Health Providers, and welcome to your quick video tutorial on GEHRIMED and InNote. As you can see, this is a familiar dashboard that everyone is familiar with. However, there is now a new widget that will be displaying on the right side of your screen that will populate as you are seeing patients within your day-to-day workflow inside of GEHRIMED. So as you are pulling up patients, getting ready to document your encounters, you will see that your InNote overlay will pull up and query patients over to the right side of the screen and look for any potential open coding gaps that these patients may have. And as you click on these coding gaps, you can expand and can see the details. These coding gaps are categorized by HCC category, and if you click on each of these arrows, you can see the details with each specified ICD-10 code that is open with inside each of these categories that you may want to address on each of the patients. In addition to that, there are identifiers that calls out the differences between potential coding gaps versus what is a suspect condition on a patient by this tag that you see here that is an SUS tag. And if you click on that tag, you can see there is also the supporting clinical indicators that you can click on, and you can see those details as to why the tool is prompting you for this suspect condition and what you can see as to what may be applicable for the suspect condition for this patient. If you do, in fact, agree with the potential coding gaps that are prompting for this patient, you can click on the arrow, and if you click accept, you are accepting that the ICD-10 code is correct for the patient. Therefore, wanting to take this ICD-10 code, enter it into your encounter inside GEHRIMED for that day with clinical supporting documentation to support the ICD-10 code. If you do not feel like that ICD-10 code is no longer relevant for the patient, you can click reject with the response for the patient. Or, of course, if it is not relevant at that encounter and you want to snooze it until the next visit, there is a snooze option as well.